In early August, at the midpoint of the Phase 2 heightened alert period, we plan to review the current set of measures. We will assess the overall infection situation. We will also monitor the status of the infected cases to confirm that the link between infection and hospitalization has been weakened by the vaccines, like in the chart just now which Minister Ong showed. Importantly, by then, 2/3 of our population would have received 2 doses, and we would have vaccinated about 3/4 of our seniors aged 70 and above. So if the clusters are under control and hospitalization rates remain low, we will be able to ease some of the Phase 2 heightened alert measures. But the easing will be differentiated and extended to only vaccinated persons because they are much better protected against the effects of the virus. This means that if you want to attend a large event or a religious service involving more than 100 persons, you have to be fully vaccinated. If you want to go out to dine in a restaurant or work out in a gym, you have to be fully vaccinated. By around early September, we expect to vaccinate about 80% of our population with 2 doses, and we hope to cover a similar proportion of our seniors aged 70 and above. We will then be able to ease the restrictions further, including allowing larger groups to get together, especially if they are fully vaccinated. We will also begin to reopen our borders, especially for vaccinated persons to travel. We will start by establishing travel corridors with countries or regions that have managed COVID-19 well and where the infection is similarly under control. So fully vaccinated persons will then be able to travel to these countries or regions without needing to serve the full 14-day stay-home notice in a hotel when they return. Depending on the risk level of the country they visit, we will either replace the SHN with a rigorous testing regime or shorten the SHN to 7 days at home. And this will allow vaccinated persons to travel more freely. Those who are not vaccinated can still travel, but will be subject to the prevailing SHN requirements. Beyond that, we will continue with a series of progressive easings. As we do so, we must expect cases to rise, partly because there is still ongoing cryptic transmission in our community, which can easily break out into new clusters with increased activity levels. Also, as we open our borders for people to travel without SHN, we will see more imported cases and infected persons slipping through from time to time. But at that stage, as you heard just now, our main focus will no longer be on daily case numbers, because the vast majority by then would have been vaccinated, and even if they catch the virus, they are much less likely to become very ill. Instead, our focus will be on the much smaller number of infected persons who need supplementary oxygen or require intensive care. So at each stage of easing, we will monitor the health outcomes, especially the hospitalization and ICU cases closely. We will ensure that these remain acceptable and stable before we proceed to the next step. But if hospitalization cases or worse, severe illnesses were to shoot up, we will have to be prepared to slow down or even pull back. In particular, we have to expect new variants to emerge, which may be more transmissible, more lethal, or more successful at evading the present vaccines. We will find solutions to these variants, especially through booster shots or updated vaccines, which we may need to roll out nationwide. But we must be prepared that the new variants can lead to more severe outbreaks and may well force us to introduce restrictions again from time to time. In short, there are still considerable uncertainties about how the pandemic will unfold globally. But our best bet is to push ahead with a high level of vaccine coverage for our people. This will give us the best chance to resume more normal lives while keeping our morbidity and mortality rates low.